Good afternoon. You're tuning into the Health and Wellness Hour on the People Station with your favorite gerontologist, Dr. Macy Smith. Today we're talking podiatry care. In layman's terms, foot care. Many of you don't realize how important foot care is to your overall health. In fact, foot conditions are among the most common health problems. Well, to help us better understand what podiatry care really means and how we can take care of our feet, are a husband and wife duo, Dr. Christine Ryan and Dr. Patrick Bick of MUSC Orangeburg. Thank you both for joining us today.
Thank you for having us.
Yes, thank you for having us.
Wonderful. Now, first of all, did I say podiatry right?
You did.
Okay,
Yes.
good, because that's the term that we hear in the industry often, but it's basically foot care, correct?
Correct, yes, and we actually encompass both the foot and the ankle. That is something that is maybe new to people that have seen a podiatrist before here in the state. About 5 or 6 years ago, the ankle and rear foot were included now in our scope. So if you see a podiatrist now that really only does forefoot or just foot care, it now encompasses the ankle as well.
Good, so y'all go a little bit above the
Yes.
foot.
Yeah.
Now,
We say below the knee, think of
below the knee, so do you all do some things with the leg as well?
Yes, yep, it's comprehensive care of the foot, ankle, and lower leg. And that could include skin issues, wounds, any sort of bone injuries, fractures, sprains, and things like that.
So when you said skin issues, I immediately thought about decubiti and how there are different stages and ranges of decubiti. Do you all see that a lot in your practice?
Yeah, we definitely have a large aspect of our practice that is wound care. It can be diabetic wound care, venous ulcerations, or decubitus pressure ulcerations, pretty much the whole gambit.
So tell me, what are some foot conditions? What are the names of them? What are the titles of them? And what are some of the signs and symptoms?
Sure.
Yes, so with athletes, you see a lot of ankle sprains and fractures. You can also see patients that have deformities such as bunions or hammer toes. Heel pain is also very common, flat feet. So there are a lot of different types of conditions that can manifest in the foot and ankle. And we are trained in a very comprehensive manner to manage all of those.
So I know that, I've heard that some very popular coaches have had some issues with, I think, turf toe. Is that like a real thing?
Mm-hmm. Absolutely. Turf toe is a real thing. Really, it's seen very commonly in people that wear cleats or turf injuries, specifically football players that have their stance where their toe, they're almost up on their tippy toes. And it's an injury to the joint of your big toe, as well as you have two little sesamoid bones that are underneath that can get irritated. They're very similar to your kneecap or your patella.
Perfect. So we're going to take a break. When we come back, I want to talk about just some signs and symptoms of a potential foot emergency where people may need to kind of come and see about it with you guys. We'll be right back. It's the People Station. Welcome back to the Health and Wellness Hour. Today's show is sponsored by MUSC Health Orangeburg, where they're changing what's possible. Today we're talking with Dr. Ryan and Dr. Bick about podiatry care. Before we went to break, we were talking about the different conditions that are foot conditions. But tell us a little bit more about the signs and symptoms, things that people can look for at home that will tell them that they may need to seek your assistance.
Yes, so starting with athletes, ankle sprains are the most common sports injury that we encounter. And they can also have, pain that's related to fractures and other types of injuries. So those can certainly become more urgent, especially if it's an open fracture that would be considered an emergency. So if you're an athlete and you have any sort of pain, you roll your ankle, you twist something in a weird way, those are all certainly things you can look for to seek care. But in addition to that, if you are a patient who's diabetic, you want to also be on the lookout for any sort of skin changes.
That's good.
Any sort of wounds that can develop, any clinical signs of infection. Those are certainly, cause for more urgent treatment.
Yeah, I would say the diabetic population is a large portion of our practice. Not only for kind of emergent things like Dr. Vick was talking about, but also for preventative care. We like to see our diabetics who have no complications at least once a year for diabetic routine foot care and routine foot checks. But those that have a previous history of an amputation or a wound or issues with feeling in their feet, or even risks with blood flow, we like to see a little bit more often, sometimes up to at least, but not every 9 weeks, just to make sure that everything is staying healthy, and they're not increasing their risk of an amputation.
So that's important too, because I don't think people realize that correlation between foot care and other comorbid conditions such as diabetes. Are there other medical conditions that correlate to foot care or the lack thereof?
Absolutely, yeah. So I always like to tell, especially my diabetic patients, that the diabetes is happening within you, but I would say the manifestation of the diabetes, it really shows in your feet first. It also affects your eyes and your kidneys, but the feet is a great place to kind of see that that's happening. It can also happen in our patients with kidney failure, kidney issues, basically anything that decreases your immune system or your body's way of protecting itself and healing itself. It very well can start affecting you at your feet first.
Yeah, you got to be country like me because you said the diabetes. Where are y'all from? I know that you all you're a part of a comprehensive care team through MUSC Health Orangeburg, but where did you guys hail from?
Yeah, we both did our medical training in Philadelphia. I was trained at Temple University Hospital, and Dr. Ryan was trained at the University of Pennsylvania.
I like how he speaks for you too, by the way.
But yeah, it's a very, our training has been very comprehensive. We were both trained at level 1 trauma centers and have seen pretty much anything there is that can happen in the foot and ankle.
Yeah, because y'all are considered foot and ankle specialists. So the fact that you've received your training outside of the state of South Carolina and you brought your talents here, like I'm from Orangeburg County, I'm from North and Norway, South Carolina. So to have two talented doctors here in our midst is very pleasing for me to hear and see. And I know also for our community, what is your catchment area? Who do you all support?
Yeah, so we support obviously Orangeburg, but the surrounding areas such as Bamberg, Branchville, Bowman,
Calhoun County.
yes, Calhoun County. And it's really just, we were brought here to try and keep the healthcare within the community. I know notoriously for a while, people have been going to either Columbia or Charleston or elsewhere to try and get their healthcare.
Which is stressful and it's a barrier.
It is,
so.
absolutely. And so if we can keep anybody here that we can help here, that's our goal, to stay within the community, to help our community to be part of the community.
Which is why we're here. So thank you so much for saying that. We're going to take a break. When we come back, I'm going to tell you, or they're going to tell you, how you can make an appointment and how you can get in contact with them. We'll be right back. Welcome back. Thank you for sticking it out with us for the Health and Wellness Hour, sponsored by MUSC Health Orangeburg. We're still chatting with Doctors Bick and Dr. Ryan about podiatry care. So we've talked a lot about what it is, what some of the signs and symptoms are. If you can put in a couple of words or a couple of terms, when is it most important for people to contact you?
Yeah, I think if you're in pain, or if you notice something that's been there for a while that's not going away on its own.
Now, pain in your foot, not your chest.
Pain in your foot.
Because we don't need the cardiac folks calling
See
you.
your cardiologist, also very important. No, if you have pain in your foot or you have something that's not going away on its own, or just if you'd like to come see us just to have your foot evaluated to make sure that there's nothing wrong, that's also perfectly fine. Usually you do not require a referral to come see us.
Yeah, I think it's very important for the folks in the Tri-County area to better understand who you are, what you provide, and how easy is it to get in contact with you.
Yes, absolutely. And as a general rule of thumb, we provide comprehensive care of the foot, ankle, lower leg, and this is both non-surgical and surgical if needed. And anyone can contact us. We are located as part of the orthopedic division of MUSC Orangeburg, which is located in the Annex building. And that was formerly the old Express Care.
Okay.
And they can contact us online at muschealth.org and also at the following phone number, which is 803-395-3837. In addition,
Say that number one more time.
803-395-3837. In addition, we also have an orthopedic urgent care that's open Monday through Friday from
Wonderful.
8 a.m. to 8 p.m. So after hours, if you have any issues with your foot or knee or shoulder or hip, they can always go to the orthopedic urgent care instead of the ED to be seen quicker. And we also have x-ray on site. So that's also open, again, Monday through Friday, 8 a.m. to 8 p.m. And there's a separate phone number for that as well, 803-395-3400. And no appointment is needed for the urgent care. We take walk-ins.
No, and I'll ask, and I'm not being sexist here when I say this, but you know, a lot of folks, they're afraid of like going to the doctor to see what's going on with their foot. It may be an emergency situation they may not be ready to deal with. But I'm gonna go to you, Dr. Ryan, to ask you this question. No shade, Dr. Big, but you know, women, we have a tendency to make people feel comfortable about receiving certain types of care. What would you say to someone who's having pain in their foot right now and have been having some lingering pain, but they're afraid to come see you because they don't want to know, or they're afraid to know the outcome? What would you say to them?
Sure. So I feel that completely. I definitely have patients that come in that are embarrassed of their feet, that don't want to show me their feet. I promise you, we've always seen worse. You are certainly not the worst case we will see, and I'm sure will not be the last. This is something that we do every day. It's our comfort zone. This is what we do. This is our bread and butter. So you can feel comfortable with us and ask us anything you need to. That's what we're here for.
Thank you both so much for being here. And thank you all for listening to the Health and Wellness Hour. To learn more about the Health and Wellness Hour, WOCS937@gmail.com. That's WOCS937@gmail.com. We want to thank MUSC Health Orangeburg for sponsoring the Health and Wellness Hour. We'll see you next week.